Hello, my name is Yusra Ahmed, and I will be discussing the increased risk for HIV and AIDS in racial and ethnic minority populations. Here is a brief timeline of the epidemic in the US, with 1981 being the first report by the CDC. So who's affected? The current challenge facing racial and ethnic minority populations is that they are disproportionately at risk for contracting HIV compared to their white counterparts. Specifically, Black people account for 42% of all new HIV diagnoses in the US in 2019, despite only accounting for 13% of the population. Within the African American population, majority of cases occurred by sexual transmission, specifically attributed to men that have sex with men and heterosexual contact. So what is the cause? Some social determinants that are contributing to the discrepancy are income inequality that has shown late diagnosis and increased incident rates, and Black neighborhoods tend to have more socioeconomic issues as a byproduct of segregation and race-related social conditions such as white privilege. And then geographically, the South has a much larger prevalence of HIV compared to other areas of the US. The high level of poverty, HIV-related stigma, and STDs found in the South likely contribute to a greater HIV incident and mortality rate. Lack of access to adequate healthcare and education is also a contributing factor and can be improved by addressing the lack of insurance coverage, availability of services, culturally competent care, and addressing medical mistrust among Black communities that stem from a history of abuse and generational trauma. Cultural factors include fear of disclosing risk behaviors or sexual orientation may prevent African Americans from seeking prevention and treatment services and seeking support from friends and family. This fear can stem from religious association, as the homophobia present in many African American churches may prevent early diagnosis of HIV infection and continued treatment, especially among youth. Some current efforts to end the epidemic include the CDC's National HIV/AIDS Strategy, which has awarded $216 million to 90 community-based organizations nationwide to deliver effective HIV prevention to create strategies for those at great risk, including African Americans and other people of color. Medication like PrEP, which stands for pre-exposure prophylaxis, is a medication used by people who are HIV negative and at high risk for being exposed, and it can work to keep the virus from establishing an infection. Some examples of technology that are being used are CRISPR gene editing technology. Scientists are able to demonstrate that HIV disease is curable, and the mobile apps such as MyPrep send reminders to your phone to take your pills or refill prescriptions and can show you where the nearest testing site is. Overall, there's a multitude of factors that contributes to disproportionate risk of HIV based on racial and ethnic minority status. Specifically, those who identify as Black and African American. From a public health perspective, public health officials need to make more of an effort to meet people where they are. With the implementation of more culturally appropriate solutions, for example, greater outreach in churches and schools to reduce stigma, homophobia, and mistrust, and to promote education and awareness. Also increasing accessibility of PrEP without insurance, as without insurance, it is more than $1,500 each month. Lowering the cost of preventative measures like medication and testing will greatly decrease the amount of new cases in the future. I would like to end with two discussion questions. The first one being, medical mistrust continues to be prevalent amongst African American communities as seen with vaccine hesitancy during the COVID-19 pandemic. What approach would you use to rebuild some of that trust? And then there's the question, what outreach programs could be proposed to combat the cultural barrier that homophobia creates for HIV eradication efforts? And here are my references. Thank you.